leave tens of thousands of people with fewer doctors and a lower level of emergency care. Administrators say the only thing that can prevent deep cuts in service is a property tax. KOMO 4's Mark Miller is live in Aberdeen to explain why this hospital is now asking voters to go public. Mark?
Well, Grays Harbor Community Hospital has grown up over the decades to become a highly regarded and full-scale medical center. But with a faltering local economy, this place now says it needs some tax dollars to keep serving patients the way they've come to expect. She taught music for nearly 30 years in this community.
I had to have the joint replaced because I have arthritis.
Now, her ability to continue playing is in the hands of a local orthopedic surgeon. She's also used the emergency room. Pat Wilhelms fears what could happen if Grays Harbor Community Hospital cannot recover from its economic nosedive.
I am just concerned that without that hospital, this community is really going to die.
Administrators here say the hospital will not shut down, but it may have to sharply cut vital services.
If we have to decrease our designation as a trauma center, we could lose those specialists and 24-hour on-call specialists.
No specialists, no surgeons standing by in the ER, and possibly no department for expectant mothers, forcing patients to the closest alternative major hospital all the way in Olympia.
Imagine being on the coast and having to drive an hour and a half to have a baby. That is not a community hospital, and those are the kind of things that we could lose.
Aberdeen's struggling economy is largely to blame for the crisis. When businesses shut down and people lose jobs, their private insurance goes away too. People get treated but can't pay. More end up on Medicaid. A new state law requires a hospital to be publicly owned in order to receive higher reimbursement rates.
They're strapped as it is.
This man is talking about the average homeowner. He wonders if a majority of voters are ready to pay higher property taxes, which is what the hospital is asking for to survive.
It would drive people away, I'd imagine, if you raised taxes. So, and there's already enough empty places around here.
Now, administrators here say they've worked hard to try to be more efficient and cut costs, laying off 8% of the entire workforce, including 20% of all management staff. Now, Grays Harbor County voters will decide whether to set up this hospital taxing district in an election on August 5th. Here in Aberdeen, Mark Miller, KOMO 4 News.